The Biostatistics unit at FHI 360 has expertise largely in clinical research, but also in complex survey sampling, in education, and a vast array of health-related research. The Biostats unit is an integral part of the research team that conducted the health research under the Preventive Technologies Agreement. In addition, we provided substantial support to Conrad, our sister organization, who is developing what we hope will be the first product that women can use to protect themselves from HIV. And our role specifically is to make sure that the data are collected correctly, or as importantly, to make sure that the analysis is done correctly, so that the study is done with scientific rigor from the very beginning to the very end. In that way, we know that the answers that we learn from these studies are reliable.
FHI 360's data management department, we design data collection forms, we clean data, we prepare data for analysis. Under the Preventive Technologies Agreement, FHI 360's data management department offered data collection services. The teams would come to us and ask us to create data collection tools. In one instance, we created a survey using iPhones, iPods, iPads, and these enabled the interviewers to actually go to the participants' homes and ask the questions directly to the participants instead of having them come to the clinics. Another instance where we used mobile technologies, we implemented a system whereby participants were allowed to be self-interviewed. So we programmed software, 5 different local languages, and the participants were able to take the surveys with the voicing of the questions. And this is a really effective tool we've used for populations where illiteracy is an issue.
Under the PTA, Product Quality and Compliance Department does testing of reproductive health commodities for USAID. Male condoms by far is the largest volume commodity that we test. In the lifespan of the PTA, we have tested approximately 8,000 lots, which represents 2.7 billion condoms. Under the PTA, the Product Quality and Compliance Department have staff members who sit on international standard committees that help revise international standards for products that we are able to test. In addition, we are able to provide hands-on training of these standards to local national laboratories.
We received a request from a USAID mission in Malawi where patients were complaining of numbness in the area of insertion of a contraceptive implant. And we obtained samples and worked with the manufacturer where we both did testing to ensure the quality of the product was compliant. The final conclusion was that additional training for the staff doing the insertions was needed in country. A request that came to us from the field was an example that was brought to our attention from USAID Washington through Bangladesh, where there were complaints of tablet cracking in oral contraceptive blister packs. And we determined that there was long-term exposure to temperature and humidity conditions that eventually resulted in tablet cracking within the blister packs themselves.
Product Quality and Compliance Department received a request from the U.S. government about condoms that were procured in Ghana. Ghana procured approximately 130 million condoms, and the proper procurement requirements were not followed. We were requested to test a sample of these condoms to help ensure the quality, and our testing showed that the quality of these condoms was extremely low. And through our testing, we helped prevent the distribution of these condoms to the Ghana public.